I'm Dr. Amanda, orthodontist at StraightSmile Solutions. We help dentists launch and scale orthodontics in their practice. Today, we'll be sharing some content from a webinar that was co-hosted with Ms. Tamara Thomas of Facial Physique Oral Myofunctional Therapy. To connect with Ms. Thomas, please use this QR code or visit www.facialphysique.com. If you want to help with an orthodontics case, please contact Dr. Amanda with @StraightSmile Solutions, www.straightsmilesolutions.com, or click on her QR code.
Myofunctional therapy. I'm Tamara. I'm with Facial Physique. I'm located in San Diego, but I do orofacial myofunctional therapy virtually, so I see patients throughout the world. So myofunctional therapy, what is it? In a nutshell, we're working on neuromuscular re-education of the head, neck, and throat muscles with other professionals. So this means your orthodontist, your ear, nose, and throat physician, your dentist. Sometimes we'll get pediatric physicians in, just depends. There's multiple disciplinaries that we need to collaborate with. So our main thing that we do, and most people would say this, is we teach exercises, but it's a little more in depth as far as just exercising. We're doing that neuromuscular re-education, meaning we want your brain and the muscles to work together in order to support your airway. Again, our main focus is airway. We work on full body health, beginning with the muscles of the mouth. And we'll explain a little bit more how that integrates with everything. So 4 goals of myofunctional therapy. By the time you're done, we want you breathing solely through the nose, day and night. We want the tongue to be completely on the roof of the mouth. That's the correct tongue posture. I'll show you a little diagram a bit later here so you can kind of visualize exactly where the tongue should be placed. We want your lips to always be closed, and we want your tongue to always push on the roof of the mouth when you swallow, not using any muscles of the face. If you can do all 4 of those goals, from infancy on, you're able to guide craniofacial growth. And that just means that the facial bones grow nice and wide and support your airway more than if the tongue is low, the lips are apart, you're not swallowing correctly, your tongue's coming between the teeth. A lot of times those bones will grow small and not wide enough to accommodate a healthy airway. I put this in here because I think it's super interesting. Why is nasal breathing important? So the first reason is nitric oxide. So there's a gas that we naturally produce in our nose, and when we breathe through our nose, that gas is released. That gas helps oxygen go throughout the body. When we're breathing through our mouth, that doesn't happen. It bypasses that system. So what does nitric oxide do? It decreases blood pressure, it improves blood flow to the organs, it's anti-inflammatory, prevents blood clotting. You can see all these different things of how nitric oxide supports our body. And simply by breathing through our nose, we can produce more of that, or the optimal amount in our body, to help our complete systemic health, if that makes sense. And it's kind of crazy just to think that if you just breathe through your nose, you can improve your health a decent amount. This article, it's a great article by Heidi Derrickson. This is just the second page here. Close to 80% of the population breathes wrong, which is huge. A lot of people say, I breathe through my nose, but if you look around, you'll see people's mouths open. They may not be gaping open, they may be just a little bit, but a lot of the population mouth breathes. So tongue posture, that's that second goal, right? So in therapy, we call it the spot. And the spot is this oval area right here. So right behind the front teeth, you'll find bumps. If you feel there, those bumps are where the tip of the tongue, right on the tip, should touch. The middle part of the tongue, the rest of the tongue, should touch the roof of the mouth all the way back. So the tongue fills completely the roof of the mouth. And if you feel, you might not be able to touch all of that. If not, then we need to you'd be a good candidate for myofunctional therapy. 95% of therapy is about awareness. So it's not just about exercises, but we need to make you aware. Where is my tongue? Are my lips sealed? Am I breathing through my nose? And without the awareness, you don't know. So that's really what we focus on most of the time, is checking in with you often to create that awareness. So by the time you're done with therapy, you know those 4 goals have been accomplished and you don't have to think about it anymore. Lip seal is that third goal. Why is that important? It houses the teeth. It helps keep the teeth nice and the arch form straight, but it also helps prevent cavities. We'll go over that in 1 second, how that goes together. I put the slide in here because a lot of people, including myself, would have their mouth open just a tiny bit. And even though when a baby sleeps and it's so cute that their mouth is open like that, that means that their tongue's low and their mouth breathing. And we want them to breathe through their nose so we can help guide that craniofacial growth. If they're mouth breathing, that means the tongue is low. The tongue isn't at the roof of the mouth to help make that growth optimal. So here's an example of what the roof of the mouth should look like. We want it to grow nice U-shaped on the left-hand side instead of this V-shaped on the right-hand side. You can see the U-shape, you're able to house all the teeth nicely, where the V-shape, there's a lot of crowding and a lot of probably some troubles keeping those teeth clean. So a lot of nooks and crannies for cavities to start. And then also appearance, obviously, is some patients' main concern. So this is a great graphic. You'll see nasal breathers versus mouth breathers kind of on the internet. A nasal breather will have a good airway size. Again, that's our main goal. So if you look at this little drawing here, he'll have really good definition of cheekbones, straight teeth, because he has a nice wide roof of the mouth. His face is wider. The nose is straight, eyes are more alert because they're getting great sleep. They're not breathing through the nose or the mouth to where they're not creating that nitric oxide. The nitric oxide helps get into a deep, deep sleep to where you wake up refreshed. The airway size is really good and they have a nice developed jaw. If you look to the right, mouth breather, we have a longer face because the tongue is low in the mouth, not helping to guide that growth. We get tired eyes because mouth breathing isn't helping systemically to get into that deeper sleep to wake up refreshed. You have more of a narrow face, not enough room to house all the teeth, so they'll kind of come in crowded. Crooked nose because the roof of the mouth is the floor of the sinus. And if that roof of the mouth is small, so is that sinus. And then we start to get that arch in that nose. The jaw will kind of go backwards. If you look at the profile, we call that retrognathic jaw. But we want that jaw to be nice and forward, lined up close to the nose, and then the small airway. Also, there'll be a forward head tilt because you're trying to breathe. You're trying to open your airway and breathe better. So a smaller airway is an increased risk of sleep disordered breathing. The most severe case, sleep disordered breathing is an umbrella. The most severe case would be sleep apnea, but there's also other things along the way that aren't as severe as sleep apnea, but they are concerning. Upper airway resistance syndrome is one. So the idea is that if we can help you nasal breathe from childhood, infancy onward, that we can guide that growth and get a good size airway and hopefully prevent anything with sleep disordered breathing. If you're a mouth breather, then we just know that we're at a significant increased risk of developing that later on in life. Even some children can have this. It's very prevalent actually in children, but it's just not as diagnosed, or it's somewhat overseen.
And obviously, I think that if the sooner we diagnose this and the sooner we treat it, the more, the more beneficial it's going to be, the less symptoms they're going to have for a lifetime, right?
For a lifetime, yeah. You're setting up for a nice airway for life, which is huge.
That's great.
Mm-hmm. So then the fourth goal, or the third goal actually, is the lip seal that we were talking about. So it protects the teeth from changes in pH balance. And pH balance, you'll hear doctors talk about acidity, or too much acidity in your diet, or you have cavities because there's too much plaque, all that kind of stuff. So mouth breathing increases that. So it changes the natural biome of the mouth that makes it favorable for cavities to become more prevalent. So it holds the framework of the arches, like I said, the lips in the front, but then the tongue at the roof of the mouth will hold the framework on the inside as well. Proper swallowing pattern. So this was a great little snippet that I took from the Hygiene magazine by Connie Sidler. She's a hygienist, but if you think about how many times we swallow per day, it's 800 to 2,000 times in 24 hours. So that's a lot. And each swallow can exert up to 6 pounds of pressure on the surrounding structures. So tongue thrust, which is when the tongue pushes against the teeth, and not up on the roof of the mouth, that can cause a lot of changes in the dentition or in the teeth. So we want to make sure that the tongue is being pushed on the roof of the mouth and creating those pressures to grow the jaws nice and wide. So like I said, we want to create that U-shaped palate with the pressures of the tongue instead of that V-shaped palate. If that is not occurring, then not only is there structural issues, the bone growth isn't happening, there's also a digestion issues. There can be patients you'll see swallowing air, babies that have chronic reflux, bloating, even constipation can be some of the symptoms of an improper swallow. So it kind of goes in depth there. So we, as myofunctional therapists, we assess dysfunction. And so we look at red flags, basically. So this kiddo is, he is like the main
Classic, classic look.
Classic.
Yeah, poor thing.
Yeah, I know. So you may just see a cute kid and he is cute, but as a myofunctional therapist, we see a lot of dysfunction. So we see the darkness under the eyes, and that's just an indication that sleep is just not happening. He's not getting into a deep sleep. He's tired. Nostrils, you can see those nostrils are flared up. That's indication that that roof of the mouth might be too small and too high and not supporting the floor of the mouth, or sorry.
So they're like vertical nostrils instead of horizontal nostrils. I never thought about that. That's so cool.
Yeah. So you can see that it's up more versus horizontal. We want more horizontal. We want that growth to be more out.
I'll look in the mirror now.
I know.
Okay.
Also, if you look at his teeth, he has some baby teeth, some adult teeth, but they're really close together and they're already starting to crowd, which means there's not a lot of room. And his tongue, you can see it between his teeth. It's low, lips are apart. And then you can see a little bit of chappedness on the teeth, right? Or sorry, on the lips. So if he's mouth breathing, we'll get chronic chapped lips. Obviously, if there's dry weather and it's not a chronic thing, it's not always the case.
Yeah.
Always chronic chapped lips, then that's probably an indication that there's mouth breathing going on. So this isn't a normal healthy state in a child. There's a lot of dysfunction going on. The airway's not supported. Definitely at increased risk of sleep disordered breathing, but that's just facial structures that we look at. Obviously, as a myofunctional therapist, we go in and we look in the mouth and assess function and how the tongue is working.
And just as an aside, for any people that are out there that want to know a little bit more about what you can use for screening tools, if you're not, already an OMT, normal amount of crowding let's say this kid is 5 or 4. Normal amount of spacing in a child in all primary dentition is 6 millimeters per arch. This child, if you look on the bottom, there's no spacing. It's only crowding. Crowding in baby teeth is absolutely abnormal. So this child is going to have a severe dental problem, orthodontic problem later, just based on what I see from this one picture.
All right. Yeah, that's great. Thanks for that input. It's good to have those measurements and to put it into perspective of measurements. All right, so dysfunction, how does it create problems? Well, we already discussed over and over, I've described poor facial growth to support a healthy airway. We discussed dental crowding or dental problems such as crowding, increased risk of cavities because of that mouth breathing. If there's grinding, if patients grind their teeth or even clench their teeth, there can be an underlying cause of airway. That's one of the red flags. Some patients can also have periodontal disease. Another red flag, not saying that everybody is, but it's definitely something we see pretty prevalent with patients for myofunctional therapy. All of that, increased risk of sleep disordered breathing, including sleep apnea. Some patients will have really bad TMJ, neck pain, shoulder pain, chronic headaches. If there's compensation, so if you're swallowing and swinging your jaw a lot, and you start to get TMJ dysfunction, meaning the joint that's right where the jaw joint goes right into the head, then that's an indication that the muscles are being improperly used. So we'll get a lot of patients also that have sleep apnea, but that they're not able to be compliant with their CPAP machine. And they're like, I can't handle this. It's too difficult for me to wear this. Well, usually it's because they're trying to breathe through their mouth and the CPAP is trying to put it through their nose. So they struggle. So if that's the case, we're able usually to get patients to be more compliant with their CPAP because we're going to accomplish nasal breathing, tongue on the roof of the mouth, lips are going to be closed, and then obviously the swallowing. But it's really nice to be able to help patients be more compliant because they're getting that oxygen. Also, there's a couple of research papers out there that Sleep apnea can be helped with myofunctional therapy. It won't cure it, but it can increase the airway and reduce what we call the AHI, which is how much they are breathing. We can reduce it by 50%, or not breathing, I should say, by 50%. So that's pretty big to be able to get more oxygen into the lungs and the body. So what does myofunctional therapy evaluation look like? What are we going to be looking at? So we do a medical history. We really go into depth from when you were a kid all the way to where you are now. Evaluate the tongue range of motion, compensations, meaning muscles that are not being used properly, and then we evaluate airway. This is just in a nutshell. We go pretty in depth. It's about an hour and a half long. We look at the tonsils. We want to look in your throat. We want to see how wide that is. That's on the left-hand side. We have a lot of grading scales that we do. On the right-hand side, we have you stick your tongue out. We want to see if you can see that little bag, and it's called the uvula. And then this is also something that gives us an indication if you're at an increased risk of sleep disordered breathing. So a class 4, meaning we can't see any of the airway, that means, yeah, there's definitely an increased risk there. So these are just screening tools that we use for the airway evaluation. It's not all of it. I'm just kind of brushing the surface. We also, I explained this a little bit. We do a range of motion. So we take measurements. We look and see where the tongue is, if it's reaching fully in the roof of the mouth, if it's down at the floor of the mouth while you're opening wide, if there's a restriction, there's a bunch of different things that can come in, but we really have you do a bunch of tests. Phases of therapy. So there's 3 phases. There's the intensive phase. We're going to work on that tongue posture. We're going to work on strengthening those muscles. And then we need to evaluate if there's a restriction, meaning that tissue underneath the tongue isn't long enough and we're not able to get the tongue where we want it to be. So we evaluate that within, usually, I would say 4 to 6 sessions can be the intensive phase if you're being compliant and doing your exercises the way you should. Habituation phase usually is about another 4 to 6 sessions. And we're retraining the tongue, creating new habits, creating awareness. And then the retention phase really is just giving you continue the awareness, finish the whole habit of elimination, and making sure that you're doing it, able to do the 4 goals without really thinking about it before we let you go. But you have to do all 4 of those, or all 3 of those phases in order to have retention. A lot of times, if you only do a couple phases, then you just go right back to your old habits. Lastly, sessions. So what's a commitment from a patient? I do 30-minute sessions. Some therapists will do a little bit longer. Some therapists will do weekly. I do every 2 weeks. Towards the end, I do every 3 weeks. Practice commitment is every day. So 5 minutes in the morning, 5 minutes at night, or 5 times twice a day. And then you have to do the exercises or we can't move on to the next session. So we're really building a foundation for all the muscles to work together correctly. If you're not practicing, then that's when therapy becomes a little bit longer. All right, so we do offer complimentary 30-minute informational sessions for you to get to know me or my associate. Her name is Selena. We're all virtual based, which we have a portal that works very nicely. It's very user friendly, and we can assess you pretty easily. We see patients throughout the world, so we collaborate with a bunch of different professionals throughout the world. If we don't know anybody in your area, we definitely network to make sure we can find a good team for you. But this QR code is a great way to book a 30-minute informational session or a full consultation if you prefer to have a full consultation where we really go into depth about everything and create a treatment plan. You can go to facialphysique.com. On the right-hand side, upper right-hand corner, there is a patient portal, and there is a link there. If you click there, it'll take you right to the scheduler, and you can find a time that works best for you. Complimentary informational session is more set up just to kind of do a quick assessment and see if you would be a good candidate to pursue a little bit more and do a deeper consultation, but it's not something you have to do. It's just something that I think is helpful, just a way to know if myofunctional therapy is a route that you think be beneficial.
That's great. Thank you so much, Tamara. Appreciate it. I'm sure a lot of patients will be contacting you, and you guys can also contact your dentist, your ENT, or even your physician, and they can connect with Ms. Thomas. So I think that's a fantastic idea. Thank you.
Thanks.